Hello, my name is Ashita Paulette, and I'm going to be presenting Maggie Dean from the Skeleton Twins. So for this presentation, I want to focus on Maggie. Maggie is a very interesting character study. She works as a dental hygienist, does not have a very active social life outside of her interactions with her husband, acts as if she's interested in having children with her husband, but is inconspicuously taking birth control pills and having numerous extramarital affairs. The crux of Maggie's diagnosis comes from these numerous stressors in her life, including but not limited to her brother's recent suicide attempt, pressures in her marriage, her socially isolated state, her 2 suicide attempts in the film, and the lasting impact of her father's suicide. So the diagnosis I would like to focus on for this presentation and this particular character is major depressive disorder, which categorized as a depressive disorder in the DSM-5 categories. So we'll be addressing 3 major questions regarding this diagnosis. How is it categorized? How does it manifest? And are there any trends and patterns we can see in this diagnosis? So major depressive disorder is categorized as a patient having 1 or more major depressive episodes but no manic or hypomanic symptoms. MDD usually manifests in the middle to late 20s but can occur at any age. Episodes typically last 6 to 9 months but can last several years depending on the individual. 2 additional crucial characteristics of MDD is that it is strongly hereditary, which is crucial considering Maggie's father's suicide, and it has a female preponderance of 2 to 1. Maggie's experience with her disorder in the context of this film is interesting. If Maggie was given a definitive diagnosis by a therapist in the film, I would assume that the diagnosis would be some kind of depressive disorder, as her symptoms are very textbook in nature. In terms of the cultural context of Maggie's experience with MDD, herein lies one of the most crucial consequences of the cultural attitude towards depressive disorders, including MDD. The disease, being quiet and private in nature, allows for the individual experiencing to shroud it in secrecy. The perception that depression is synonymous with laziness and weakness contributes to this stigma. Women in particular have a unique relationship with depression. The patriarchal perspective that women are responsible for caretaking, and that this is a fundamental component of womanhood, can be challenged when depression is brought into the mix, with depression being stereotypically synonymous with inactivity. This notion is explored in the film, with Maggie not feeling emotionally prepared to raise children, but feeling as if she must be interested or pretend she is interested to satisfy her husband's desires. Now we can move on to the evidence of MDD that Maggie exhibits. First, we have feelings of worthlessness, first we have the presence of suicidal thoughts and actions. Maggie is seen in the film intending to commit suicide at the very beginning by overdosing. Near the end of the film, Maggie threatens suicide again by tying weights to her feet and jumping into a swimming pool before being rescued by her twin brother. Suicidal tendencies are a distinct symptom of individuals affected by MDD. Another symptom that Maggie exhibits is that of feelings of worthlessness or inappropriate feelings of guilt. This is most apparent in her relationship with her twin brother, who was molested in high school by his teacher. When Maggie discovered this illicit relationship, she reported it and the relationship promptly ended. This prompted Maggie and her brother's estrangement. Maggie feels guilt over the nature of their relationship, despite the fact that reporting this inappropriate conduct between her brother and his teacher was an objectively beneficial action. A symptom that Maggie does not exhibit to a great degree is that of appetite disturbances. This particular symptom is usually categorized as an increase or decrease in appetite. Within the limits of what the film reveals of the character, we don't really see any such moments with Maggie. Now we can move on to the proposed treatment plan. So the first step is to stabilize the threat of suicide. This can be accomplished by providing Maggie with information for a therapist or an emergency hotline with the purpose of contacting if suicidal urges do arise. If such a circumstance does arise, ensure that there is a thorough plan for hospitalization. This is crucial for Maggie, as suicidal ideation and action is behavior that she has pursued in the past is characteristic of individuals experiencing MDD. Another component of this treatment plan is organizing regular therapy appointments for Maggie. Given the repeated suicide attempts and the stressor she is experiencing, it is crucial that she is given regular attention and strategies to deal with her circumstances. By participating in weekly therapy sessions, particularly cognitive behavioral therapy, to identify and confront thoughts of suicide and hopelessness, Maggie will be able to learn to manage her symptoms. Finally, Maggie should begin to explore medications that can help manage her depressive symptoms with the help of a psychiatrist. For example, selective serotonin reuptake inhibitors are common prescriptions for individuals with depression disorders. This, in combination with regular therapy sessions, will begin to address her negative feelings towards herself, reckless behaviors, and other relevant symptoms. There may be some situational obstacles preventing treatment. For instance, seeking therapy requires proactive action from the client herself. Because Maggie's isolated state and somewhat lack of a support system in her immediate vicinity, she may deny herself the opportunity for treatment due to her lack of motivation to seek it out herself. This film is an accurate portrayal of MDD. This is rooted in the fact that Maggie's depiction of depressive disorders is not glamorized nor is it overdramatized. Instead, she offers a realistic depiction of an individual struggling with her illness. She engages in behavior that she does not fully comprehend, such as the extramarital affairs. She suffers silently with her feelings of guilt and struggles to reconcile her role in her relationship with her brother. This film helps educate its audience regarding its honest portrayal of MDD. Depressive disorders are not romantic or cinematic. Rather, they present daily obstacles that may lead to drastic actions such as suicide. Even further, MDD is a medical disorder, and Maggie's final scenes in the film with her receiving psychiatric help emphasizes that such illnesses demand swift and thorough attention and treatment. So this was my presentation and diagnosis on Maggie Dean from the Skeleton Twins. Thank you so much for watching.